Okay, I'll give you just a little background about me. I went through massive Western medical training. So I'm board certified in general surgery and board certified in plastic surgery. And I worked as a plastic surgeon for about a dozen years and took care of a lot of breast reconstruction patients for multiple different reasons. One, my mom had breast cancer, and that happened before I got to my residency. And so that's kind of, spurned my interest in breast cancer. And so I got active in kind of the Western traditional sense where I was the spokesperson for the American Cancer Society on breast cancer issues. And I was taught to say that we don't know what causes breast cancer. We don't have any known cure. The only thing that women could do are breast exams and mammograms in the hopes of catching it early and saving lives. That was my line, right? So in my practice, I'm watching my patients get younger and younger and younger. And finally, I'm doing breast reconstruction on women in their 20s. And I'm thinking, something's like way wrong with this picture.
I'm going to be talking about estrogens, estrogen receptors, estrogen metabolism, and cellular immunity. Then that's going to lay a background to get into what is called cell differentiation. The difficulty with becoming cancer-free is killing the cancer stem cells. And that is what cell differentiation is about. And so every cell in you head to toe has what is called estrogen receptor alpha and estrogen receptor beta sites. The biggest event in the development of cancer is the loss of the beta receptor sites in a cell. That is where the anti-cancer compounds go in the cell that kills cancer inside the cell. So what we see in research, healthy people have greater numbers of beta receptor sites in the cell than alpha receptor sites. Cancer patients are vice versa. They have a greater number of alpha receptor sites in the cell than beta.
Lymphology is my favorite stuff of everything. So studying medicine and studies of lymphology, TCM, traditional Chinese medicine. So a lot of knowledge on this piece of paper, a lot of knowledge here. Well, sometimes it breaks out. I think everybody here knows about lymph system. No? Yes? No? Show me who knows something. Okay, that's not much. I expected more. There's something to say about the lymph system. It starts with organs of lymph system, which are producing immune system and also taking care of heaps of things of fluid. So this is called a very dramatic schema of a lymph vessel.
I have a question for the lymph therapist. Would you recommend your techniques, the lymphatic drainage, for someone who has a primary lymphoma?
Lymph drainage is so old, and I think the most important thing is just if you have the best way of checking your body, you can use lymph drainage for everything. In some cases, when the metastases go to the system, I wouldn't do it. And there are also things like heart diseases where you're not able to do it. But most of the time, it's just depending which kind of drainage you do.
Let me make a comment on the lymph system. About 15 years ago, I went to Salt Lake City. There was a doctor there who was doing some work on lymphedema and others. But what he did, he had an athlete, and he had him rigged up with oxygen, and he had him on a treadmill. That athlete also had on him a fluoroscope so you could see the lymph system in him. And when he held his breath, ran as fast as he could, the lymph system did not move at all. When you breathe, the lymph system jumps. And so exercise will increase the circulation in the lymph system, improving the drainage.